Hi, everyone. Welcome to the virtual road trip for August. We're going to let people get on. I'm seeing the participants join quickly on, and we've got many of you. So we are excited to be talking to you today about person-centered care and the environment that we're in now and changes that we have seen and will be seeing in the future. So it promises to be an engaging conversation, and we look forward to all of you out there engaging with us. And so don't hesitate if you have questions or comments that you want to add in the chat, go ahead and do that. We will address them either during the chat or at the end. We're going to allow for some time for questions and answers and addressing those as well. So I will go ahead and introduce myself. As the participants are slowing down a little bit. So welcome everyone again to the virtual road trip for August. I am Pam Brandon. For those of you who are new to this road trip, I'm the president and founder of AGE-u-cate Training Institute. A little bit about ourselves. We develop and deliver effective, innovative, research-based dementia and aging training for professional and family caregivers. Our programs improve the quality of life and quality of care for those who are living in elder care communities, home care, hospice. Our programs are implemented in over 800 communities and long-term care providers, hospitals, universities, and community-based organizations throughout the US, Canada, and Australia. So that's a little bit about us. Happy to welcome our two guests today, Penny Cook, who is a great friend of ours and colleague. Penny is president and CEO of Pioneer Network, a 23-year-old nonprofit organization dedicated to changing the aging and the culture of aging, sorry about that, and enhancing the quality of life for those who live in and work in long-term care communities. For over 28 years, she has provided education, training, and advocacy related to the care and support of elders. She is passionate about helping us value our own aging as well as those that we serve. So welcome, Penny, and welcome, Janine Finck-Boyle. So happy to have you as well. Janine serves as the Vice President of Regulatory Affairs for Leading Age. In this role, she oversees Leading Age's response to and intervention in processes for state and member input into proposed rules for CMS and other regulatory bodies. Among many other responsibilities, Janine ensures that Leading Age's regulatory positions are driven by sound policy analysis and well coordinated with the association's overall advocacy program. Janine brings over 20 years of leadership experience in the long-term care sector to her role with Leading Age. So welcome, ladies. We're thrilled to have you both. And for all of you out there, and we have a great group, a large group, and I see it's still growing. So if you're just hopping on now, we will go ahead and get our discussion started, which is person-centered care environments, what's happening now, and what does the future hold. And certainly we could talk for hours on this because it's a long and complex topic now that we're moving into the 6th month of COVID, which is hard to believe. And with many of you out there, and we certainly all understand, our conversations have changed weekly and seems like daily over the last 6 months. So this is a conversation that will continue, no doubt, as we move through the pandemic. So I'm going to start and just ask you a few questions to get the conversation going. Obviously, COVID-19 is front and center for all of the stakeholders in this field. It is on everyone's mind every day. And so let's start by just talking about how our senior living communities have been affected by the pandemic. Penny, do you want to start? And we can
Sure.
jump in there at any time.
Thank you. And thanks, Pam and AGE-u-cate, for hosting this. I think that this is such an important conversation. And you're right, it is on everyone's mind because I think this is something unprecedented that we've never seen before, that's impacted all of senior living communities, and no matter the type of care and support that is provided. I mean, it's impacted all of us. And I think the initial impact was on the safety and security of residents and staff and family members and loved ones. And then as we began to move through this, we've seen that psychosocial impact. And I would say that that psychosocial impact is on everyone as well. But when you have the visitation restrictions and the lack of the ability to gather, I think we've seen that so much. And at first, I think we all thought these would be short term. And now, as you said, we're in the 6th month of this. And as it's continued, we've now seen some of the financial impacts. The financial impacts due to the staffing that's needed to be provided and just the staffing issues that we've had. The testing, the PPE, the personal protective equipment that communities have had to purchase. I think all those things have had an impact. And I think that that's probably going to continue at least into the short-term future as well. But I think that when we talk about impact, it's not all negative. There are some positive things also. And that might sound strange to say, but I don't think we can forget, you know, there's two sides to every coin. We have seen some of those positive impacts of communities coming together and the creativity and the innovation that's happening. And I know we'll talk about that a little more, but that's really been heartwarming to see. And it shouldn't be forgotten. I think the thing that really, as we talk about impact, is most present for me right now, and we were just talking about this before we started, is we're not exactly sure when that light at the end of the tunnel is going to come. And I think that's the part that's probably, you know, a little concerning right now as we enter into the fall, as we enter into the 6th month of dealing with the virus, is that so many times we have an idea of when things are going to end, of when we're going to sort of be out of the mode. And right now we're dealing with uncertainty. And I think the impact of that is really huge to everyone.
Absolutely. Absolutely. Janine, what are you hearing from your members?
So our members, as they're through the continuum, and we have members that are home and community-based settings, we have residential care, so life plan communities, assisted living, independent living, nursing home, and then one of the other sides is our housing communities. You know, what we hear, and to echo what Penny said, is the cost, the expense of protective equipment, of testing, the uncertainties of testing, and whether asymptomatic or symptomatic. You know, let's just talk about nursing homes for a second. You know, this seems like between CMS, CDC, and with HHS's initiatives, there's always a new regulation, a new guideline. And so nursing homes are really, you know, bearing the brunt of what you see in the media, but they're trying to actually comb through everything to make sure that they are ensuring that the residents that they're caring for, that they're safe, that they're doing what they need to do. But then you have the staff. And so what we're hearing across the continuum is the breakdown that staff is having, that the workforce is not just becoming infected with COVID, but the mental health and their well-being is the strain coming, as you said, into the 6th month is really starting to affect people. And so what we're hearing from our communities and from our members is ways that they're trying to now look towards the future. You know, before it was, I think everyone knew, there was hero pay or incentive pay, or maybe a gift card to a restaurant or a grocery store. But now we're seeing, you know, those still continue for communities, obviously looking at the financial impact. But the now is really trying to take care of people, making sure they're taking days off, making sure that they are getting any sort of counseling or any employee assistance programs that they might have that can also be part of their daily mantras that any of the staff might be having in the organizations, and then working with the staff to work with their families. And then what I just, in the last few weeks, what I know communities are dealing with, I was just on a call with some of our life plan communities last week, is the fact that schools are starting. and a lot of schools are virtual. And how are households, how are staff members that leave their home every day to take care of our elderly individuals, how are they going to now work and then come back and make sure their children are signed in, signed on, virtually learning? And how is that going to work? And I've heard some wonderful, wonderful opportunities that some of our life plan communities are doing, working with some of the residents in their communities that have retired teachers. And they're going to do virtual pods and set up a classroom so that, just like we're doing here using Zoom, and help some of the staff's children, which I thought was wonderful. And I know, believe me, I know not every community can do that. Not every community has the resources to do that. But, as I said, just taking care of the staff, because they're the ones that are there in the long haul. They're the ones that came to work every day and left their families to take care of people in their organizations, which, I come from as a provider, as a nursing home administrator, and I know every day that was, difficult decision, but they did it, and they be rewarded as much as possible and appreciate it.
Yeah, it clearly, when the pandemic started, we had the focus on, resident care and safety. And just as you both have said, that's moved into really focusing on how are we caring for the staff, who are enormous challenges in school, those with school children, especially managing that and the stress they have. What this brings me to, what is the viability of the senior care community? What is that going to look like? Is there, trying to stretch and trying to meet the needs of at another level of their residents and their staff and the financial strain that's taking? Where do you see that, Janine, going?
So I will say, what and what we really looked at was the ability to not admit, right? So a lot of our, I'm just going to start with nursing homes, that nursing homes there were no short-term stays. And so, because there were not elective surgeries in the hospital, so your typical rehab units in nursing homes that had knees and hips and maybe an IV antibiotic, you weren't seeing that. And so that was definitely what we heard from our members was starting to be a concern.
Mm-hmm. Oops.
And we were just talking about those technical issues that we all experience.
Yeah. She may come back. For all of you, Janine is on Cape Cod right now, so we feel somewhat sorry for her, but we'll wait for her to come back as we continue this. Anything you want to add to that, Penny?
Sure. Well, I think that one of the things that we're seeing is that, I think where Janine was going with that is that on the nursing home side, short-term admissions were stopped. And then I think that idea of having people move into your community was stopped for so many different communities out there. And of course that has an impact on so many things. But I think that as we're moving forward, I've always said that we have more options now for senior living than ever before, and that's something that needs to stay. And so when we talk about all the different types of care environments, I really hope that all of them are going to remain viable. And for instance, we do look at nursing homes because I think those are the type of care environments that are sort of always on the edge, but I do think there's always going to be a place for nursing homes. I just think that they're going to look different for the future. I think that senior living is going to have to look a little bit different. And I think that there's been this emphasis on the clinical. And I think that what we're seeing now is that there's going to be more of an emphasis too on the social and the other ideas of well-being.
Welcome back. We can't hear you.
Oh no. And I think that this emphasizes for everybody out there some of the issues that we do have with technology sometimes and that we're all living with.
Yeah, exactly. Janine, I had to share the secret that you're on Cape Cod. We all feel very jealous.
Again, please forgive me. I'm so sorry. It says no internet. It's weird. It just shut down. But I think the point I was trying to make, it is a beautiful day here, a little cloudy, but is that I think that, we don't really know the end game for the viability. I think that when we look at the expenses, when you look at testing, if there's different mandates in states to test staff weekly, to test residents twice a week, there are initiatives that HHS has put forward for nursing homes and I think everyone knows about the antigen, the 2 different testing kits and machines that were given, but there's only a small amount of supplies. And so nursing homes now need to dig into their pockets to then continue what the state needs them to do to get to. So remember, it's all layered, right? So they need to get to a certain point so that they can reopen and have outside visitation or indoor visitation, wherever that looks like. But then the testing costs dollars, the PPE costs dollars. They're not seeing admissions have slowed down. I think you've seen in through different articles, and I know we work with some different consulting groups that are members that have done some studies about move-ins, and life plan communities have slowed down. There's been a lot of home and community-based services. We know adult days have been shut in states. But the viability of our continuum, it's really going to change. We will see nursing homes that will have to close. We will see some home health organizations that might not be able to continue a load of patients and might need to either maybe merge with another one or close too. And I don't know if adult days will be able to open back up.
Yeah, we will see changes, and organizations need to evolve over this, and certainly the nursing home environment in particular. Let's go back to pre-COVID and talk about, Penny, the strides we were making with person-centered and culture change movement, because we were doing so many good things. And that's not to say it's dropped by any means, but it has definitely had an effect on moving forward with COVID. So let's go back to pre-COVID and talk about that a little, since that is just the core of Pioneer Network's mission, and where the tremendous work they've been doing for the last 23 years has been.
Yeah, I think it's interesting because I do think it's always important to look at where you've come from in order to figure out where you are now and where you're going. And I think that especially as we talk about this idea of culture change and person-centered care and the move to create home for people who live in senior living communities, that it really does kind of align with the conversation that we're having right now. Because if you look at, the first nursing homes of the 20th century, they were modeled after hospitals. And that meant those, sterile environments with long halls, with many people living in a large room and sharing a communal bathroom. And it's and a focus on really the medical needs of people. And when we talk about like institutions, the first nursing homes were institutions. And I'm not saying that critically, it was just how things evolved and how they were financed and things like that. And we think about that now, and it's really why culture change started, is that those were environments that people were living in. Those were their homes. And is that really the kind of home that people wanted to live in? And that's why Pioneer Network started. It was really to help change that institutional environment and transform it to one that's home. And, during the course of this, assisted living communities began to flourish, and we saw life plan, continuing care retirement communities, and people had options. People began to have options. And so we worked in the nursing home world to make sure that people who moved into nursing homes had a home environment as well, truly had home. And I think we've been making great strides towards that. And now we talk about person-centeredness, person-directed living, and I don't think that there's a community out there that would say, oh, we don't believe in that. Of course, everyone does. I think that's the kind of environment that everyone wants to provide. It's just a matter of how we do that. I mean, the idea of changing culture is hard. That's why, we actually work on it. It has to be intentional. And I think through education and training and networking with other communities. I mean, it's one of the things that Pioneer Network has provided, but it's one of the things that Leading Age has provided, and so many different organizations out there. And Pam, AGE-u-cate provides that too, is that idea of how do you care and support people in a way where you make sure that their choices and their preferences and their voice is heard. And so I think that we have been making great strides for that. And I know that, you know, within the past 6 months, that's been challenging in some ways because we've had restrictions. And we talk about so much the dignity of risk, of making, you know, of the fact that people, we all have the right to have some risk in our lives. Well, the past 6 months, you know, that's a big challenge. You know, is this a risk that we want to take? And as Janine said, I mean, communities have just worked on, especially initially, keeping people safe. And now where, I mean, as we move forward, I think it's going to be really interesting to look at this evolution and how we do balance all that, how we do balance those individual rights and community rights. And the community is not just that you know, community of one senior living site, it's the community at large. Because as we're talking about staff members having children go back to school and the effects of that, I mean, it's a big thing to look at. But I think that the thing that we have to do is have conversations like this, make sure that that communication line stays open.
Absolutely, among all stakeholders. And because as much as we've been challenged with things that we, you know, never, you know, these elder care communities have never thought they would face, it also has forced some innovation and creativity that they never thought about either. And so some of that is coming out, that, you know, we can do things differently. We have to do things differently. And there are these things that we've been doing wrong that have to go, and, you know, or be refined. So yeah, absolutely. Janine, did you want to add to that?
I do. I think what's really showing the innovation and the creativity that's coming forward is that there have been the ability where telehealth is being used, and then telecommunications as a whole, just like in we're using the Zoom platform. And I think that if you kind of go back and you think about, as Penny was talking about, the medical model in a nursing home, you had, you know, once a quarter you had a care visit with the family, and you have planned that out. And sometimes the family would be able to come to the organization, or sometimes it would be by phone. But nursing homes and a lot of continuing care communities have been now pushed into the ability to use the telecommunications, use, whether it's, again, lots of different platforms that everyone knows what's out there, but actually be able to connect, because people couldn't come into the organization. There were no visitors. And then using those for not just the care visit, but to use it on a social visit. And so there were other ways to use technology for communications to families. So notifications and newsletters, and, you know, doing recordings. I know we have some members that were doing weekly recordings and then posting them on their website and updating their website, you know, some even daily. And just really being able to make those connections with families and responsible parties, and then the community at large, working with hospice organizations. You know, I know there was a lot of interaction with hospices not being in, coming into organizations at the very beginning. And so, you know, how, you know, once that was straightened out, you know, through guidelines and with regulations and so forth, but really being able to work with physicians, you know, again, you know, dental and eye and all of the podiatrists, all the visits that need to happen, but be able to use the technology at your fingertips. Now, it comes at a price. And you know, we talked before about viability, but there's also been opportunity through the Civil Monetary Penalty Fund to be able to apply for dollars in order for nursing homes to get iPads or whatever they would need. I know there's lots of different technology companies out there that have been working with many of our aging services providers to help them. But still, you know, there's still dollars that have been put in the CARES Act. dollars that I know, and we'll talk a little bit about advocacy in a bit. I know that's a huge part of what I also do. But there is innovation and creativity to be able to use the technology, and we've seen it. I mean, there's been wonderful stories. We had daily calls. We're now doing twice a week calls, and we have members that are talking about everything that they've been doing using telecommunications, telehealth, and virtual visits. It's been great.
Absolutely. One of the things that I wanted to add too is so many of our providers, I think, are more focused now than they ever have been on the needs of families, because it's been so important that they keep that connection, and I think that's great, because some of what I'm hearing is that people are now getting used to this virtual connection, that this is not going to go away, the virtual platforms. So I think there's going to be a blend. When things open up, people are going to be very much wanting to be with people, obviously, and be with their families, but that the virtual connection won't go away, and maybe a better understanding of what families go through when their loved ones are in community or caring for them at home. I think there's going to be more efforts from many stakeholders to support families through this.
Most definitely.
Yeah, there's a question that came through. I think it was about the time that we lost you, Janine.
Sure.
So from Maryland, do nursing homes need to fund the testing even though it's being mandated by the state?
Well, so each state has a state plan. So in particular states, some states, so Wisconsin, New York, I know they have a plan where they're going to pay so much. And so you really need to check in with your Department of Health could probably tell you what that would be, or your Health Regulation Administration. Usually it's what the governor has set for the state. So some states are paying up to a certain amount. Some states are paying at the whole kit and caboodle, depending on what the state has decided. And some states are paying nothing. And it differs between nursing home and assisted living. So that's something it's state by state.
Mm-hmm. Okay, let's talk about the future for aging services associations. I think this is a big topic. Where do Pioneer Network and Leading Age, where are you gonna fit into all this going forward? Another giant question, right?
Right.
Loaded question.
Yeah. I can start a little bit just to kind of talk about what we've been seeing and where we know we're going. So as you know, Leading Age has an annual conference, and we do a large conference in the fall, and then we do a leadership summit in the spring, and then our state affiliates, which we have 38 of them, do their own state conferences. And so as everyone is not a surprise, going to virtual, and that's fantastic, and different ways of doing virtual education, virtual the business association side, with the exhibitors. But I will tell you that from the seat that I sit and where we are at Leading Age, we have been working on advocacy. We have 5 essential actions. Obviously, they all fall around testing and PPE and funding and so forth. But we can't walk up to Capitol Hill. We can't walk into Senator Grassley's office and talk with him or his staff. And so what we've been doing is we've had over 50 virtual congressional visits with either they were staff of a particular senator or congressperson, or with the senator or congressperson themselves. And we've been able to actually really forge forward and look at what's going on and make sure that we're part of what is being changed on Capitol Hill, what's being drawn up on Capitol Hill, but doing it virtually. And we have members on those calls too. So we're working with our state execs, members in that state, to work with either, as I said, their congressperson or their senator. And with the 50 plus visits, we've had probably almost 200 members on those, and they've been phenomenal, amazing. I think we get more done in a 30-minute virtual session than we had, taking time to get in a cab and go up to the Hill and having people fly in. And so I see that as something, as a part of our future for Leading Age. It's still different. Want to walk the hall, Capitol Hill, walk the halls in Capitol Hill and get that, face-to-face interaction. But this is something that I see for our future. And I think that it's the advocacy part of that really gets us to be able to dig down deep and connect so many more people to help the lawmakers really, make the changes that need to be put it forth, and then also the discussion before those changes even go forward.
So all of that is still marching forward.
Yes.
And getting done, which is great. Which is great. You want to add to that, Penny, on what you see?
Yeah, it's interesting because with Pioneer Network, so much of what we do is education and training and connecting. And, we do a lot of in-person connecting, and we've had to pivot and move into the virtual world as well. And it's really interesting for us because we had actually talked about doing more virtual education and training. And I think just like so many things we've seen, it's like, okay, well, this is the push you needed. You really didn't have any choice. And so we moved along with that, but it's interesting what we found. And so for us, we hold an annual conference as well, and we're going virtual this year in a couple of weeks. And one of the things we've been able to do is offer senior living communities, the community, the education and training and being part of our program. And we've had communities that have said, well, we're not only going to have our staff participate in this, but we're going to open it up and our residents can participate as well. And they've asked about family members. And I'm like, sure, family members can participate. We've never had anything like that before. So to be able to spread some of this and even move, outside of our normal audience, I think has been wonderful. The other thing that we found ourselves doing a lot is connecting people virtually. I mean, because we sort of welcome everybody. We're not a membership association, and it's anyone who really wants to further the idea of culture change and person-centeredness is sort of a member, a pioneer with our network. We've been able to do a lot of connecting. So people who have questions about, what they can do and different ideas or how are other communities doing this, we found ourselves connecting organizations a lot more than ever before. And I think too, what we've realized is people want that connection because we're not able to get together in person. Having some sort of connection with communities around them is really important. We've also found as we've been connecting resident councils too in nursing homes with each other and doing some of that virtually because resident councils are doing things virtually. It's just been, it's been sort of that push that we needed. Unfortunately, we didn't want it.
All of a sudden, we lost her.
I know. She locked in, and then I heard her talking. But yeah, technology.
I think one of the as we were talking before this started between the three of us, that it may look like we may be looking at a hybrid, some hybrid in-person and virtual going forward as we level out the financial viability of many organizations. Hi, Penny, you're back. You froze for a minute. Can you hear us?
I can. I froze now, and I'm hardwired.
So yeah, I think the virtual is going to be pretty important in the next year, 2 years, as organizations stabilize themselves financially, and we offer different options for them to continue to connect with others and be educated and meet their, their budgets.
Right. I think we had talked initially also about preparing all of our team members, all of our care workers for the new normal, right? The new normal, and how they can be trained, and it's not just your annual in services, but there's so much more when especially when as we've been talking about person-centered care and the changes that keep rolling out, whether it's from CMS or from HUD, and then what is required, and what does everyone need to learn and know, and then how do you get that training? How do you then succeed and make sure that your team members and your staff are up to where they need to be? And they will, need to use virtual learning and use electronic platforms for education.
Yeah. Absolutely. Well, this is a good segue into the next topic I wanted to delve into because it's huge. And this has been long before COVID, but workforce recruitment and retention. This has been a driving issue for years. How do you see stakeholders coming together to attract more people into aging services? So much of what we've heard and seen on the media is negative, especially recently, and at a time when we need more people than ever in aging services, and where the future just continues to look forward. We need lots and lots of people. How are we going to come together to change that message?
Well, I can kind of start a little bit and talk about what we've done at Leading Age and what we know that our state partners have been working on. And it's been, as you said, way before COVID, but it's really looking at careers in aging services. And so I think that when you first say a nursing home, the first you think about is a nurse or an individual that's clinical, that's taking care of the resident in the nursing home. But what we've done with this particular campaign was really try to open up the careers in aging services and really look at the fact that for dining, that there are chefs, there are individuals that are working in a cafe style. So it's not just someone in the back in the kitchen putting a tray together to send up to a unit. As you know, we talk about person-centered care, and as Penny knows, the environment is changing. And so looking at that, there's the culinary arts, that going to school because you want to be a chef and you want to work in culinary arts. Well, where there's 5-star meals that are being prepared in different life plan communities, and that you can have that career and work in aging services. The same with when you talk about finance and the business office and marketing, there are also areas there where those particular careers that you might have and you might not think to be in aging services. You might not think that I went to school and I followed through and I'm an accountant, but aging services needs accountants too. And so there's a lot more opportunity that's always it's always been there. But what we've been working on with our members and with our state partners is to really work with different high schools and even in elementary schools and community colleges and four-year colleges to show that there's a breadth of opportunity in aging services, that it's not just the clinical care.
Yeah, and starting early.
Right, starting
early into the opportunities. Absolutely. Penny, are you able to join us?
I am. I might be frozen, but hopefully you can hear me and I can hear you.
What did you hear?
Yeah, so I heard what Janine said, and I totally agree. And I think the other thing is something you talked about in the beginning, Tam, and that's the perception. The perception that is rampant, I think, about long-term care, about senior living. And I think part of that, and we talk about this, is because of some of the ageism that we have in our society. And so when people are working in care communities, sometimes that work is not valued as much as it should be. So I think that one of the things that this time of COVID has given us is the opportunity to really talk more about all of the positives of senior living. And I think that's something that we all need to be a part of, that we all need to work towards. I think that when people ask us what we do, we need to be very proud of the work that we do. I think that we all need to share those personal stories. And I think there's so much good that's going on, and we all know that. And sometimes we're hesitant, I think, to be the one who sort of highlights everything. But it's our responsibility to do that if we want to see things change. And I think that we can attract more people into senior living if we can try to work to change that perception that people have.
Absolutely. And so many people have, and I am a perfect example, came into this field and passionately because I was a personal caregiver, it was my personal caregiving experience with my parents that started me on this road. And there are so many with that same story that I have, that they saw this. It's a very fulfilling field to be in. There's so much to learn. I mean, aging is quite frankly, it's, to me, it's fascinating. And it's, something that provides not only opportunities, but I think for me, working with colleagues who are passionate at many levels within communities and with others who are doing the same thing, I just really see the need for much more collaboration among stakeholders, and for us to be able to have these conversations and talk and learn from each other. So I love that we're doing more education early on, and opening up this field as something that has a great future for young people. Let's talk about training, because I happened to just pull off some information last night on something, and we are very focused on workforce retention and quality training, and training that works and training that doesn't work, and how to train. And there's so much more now going into this than ever before. But a couple things I just want to read to you. 94% of employees state that they would stay longer at a company if their employer invested in their career development. That's one. And here's another one. Passive learning, where employees are spoon-fed information without an opportunity to apply and use the information, has been shown to be ineffective. Have we been training ineffectively for too long?
Well, I'll start with that one.
well, I'm shaking my head.
I'm pretty passionate about this, since that's what we delve into.
I think, Pam, you can answer this question. But I don't, I wouldn't look at it as that we've been training ineffectively for too long. I'm a big believer that we've done what we thought is right, and then when we know better, we do better. And we're at the point now where we've been learning more, so we should be doing better in senior living. And I think that those statistics, are something that we've seen. There have been so many studies done, for instance, with CNAs, and why there's turnover, why people leave communities, right? And the thought that everyone has is that, oh, it's because of pay. Well, that's usually not the number one thing. It's that idea of being valued and respected, and having education and training is a huge part of that. That does help people and support people to feel valued. But I also think that it's that training in different ways. And that, I think that education has seen this too. We all learn differently, and we have to actually grasp onto that and realize that our training program should not be a one-size-fits-all model. Just like we talk about person-centered care and support that's based on the individual, our training, we need to look at our training to have different modalities of training for different people as well. I think that's so important. And I think we need to look at, what do we want people to come away with? Let's look at that first, and then let's figure out how we're going to provide education, and provide it in different ways so that people not only understand it, but they do feel comfortable practicing it.
Absolutely.
Right. I couldn't agree with you more, Penny. I mean, it is amazing to know, when I think about my past experience, that again, you're there to have an annual in-service, check a box, and and move on. But now when we look at person-centered care and having the resident engagement, also I think as in how that can be part of the training. But we look at I know Penny brought up CNAs, and it makes me think also about individuals that work in laundry and linen and environmental services and security, that it's not a traditional career ladder. So what they're doing, going going in and out of residents' rooms or in and out of different parts of the organization, you know, they're the eyes and ears also. So how do you engage the staff as they're taking the training to really know about the resident and know that, you know, oh, you know, the resident I go in and pull the trash every day usually says hi to me in a few different words. And then today they did not. And then where do they go to tell that? So that's all part of the training. It's not just those annual in-services about fire safety and obviously infection control. I'm not saying that that's not important. They're all important and they're all needed, but really getting that resident engagement in as part of the training. And as Penny said, different modalities because people learn differently, most definitely.
Absolutely. I wrote down as you were talking, Penny, you know, the need to certainly address the issues of pay and you know, benefits and all that. But when it comes down to it, if someone feels valued and they are empowered with knowledge, they will feel much more confident in the job they do. So if we're training them beyond the regulatory, you know, the basics, the check the box training, and we're really training people across all disciplines, because that's really what it takes to make a culture change, person-centered care community. You have to train all disciplines. You have to train the housekeeping and dining and everyone who touches that resident, right? You have to do it with families. If you do that, then you are on a path to culture change, because everyone is understanding that knowledge, and they're able to apply it together. I think it does so much more for team building and just growth of that organization and their mission, meeting their mission and objective. So I think we have a tremendous opportunity again with technology now to be able to bring training that is experiential and interactive via a platform where it doesn't have to be in person, and it can save that organization money. And learning, you know, getting back to the basics of simple tools, teaching everyone what is the aging process. I mean, that's huge. Certainly dementia training is huge now. The need is growing. And, you know, that goes from independent living all across the spectrum of long-term care. So I think looking at, as we looked at long-term, at independent living, the age has gone up every year of those moving in. And so we have to adjust, I think, who we're training at each level of care. Would you not agree?
Yes.
I would think that too. And I think the other piece of training that we always have to think about is communication. Mm-hmm. I think that's something, communication, leadership training, and understand that leadership training is not just for our traditional leaders, that it can be for everyone, because that's so empowering to all staff and team members. Absolutely.
Absolutely. Could not agree more.
Right.
So as we wrap this up, I always want to end on, you know, on a good note. And I think we've talked about a lot of good things in this conversation. We've learned a lot from the past. We've certainly learned a lot in the last 6 months. We're going to continue to learn in the next 6 months. We're not going to forget this experience, but, you know, as the media does, you know, there's 95% negative, and that's what seems to, you know, be what's out there when there's so much positive. What would your final, you know, words be to all these participants out there about where we've been and what do we have to look forward to from all this that we've gone through?
So I would say is the collaboration, is that although there are days, I know myself, I get up and I really think about, you know, it becomes pressing on you, you know, working from home. I'm always used to being somewhere around people, in this case now being in an office versus an organization, but really figuring out ways to collaborate, whether you're collaborating with your team members, whether you're collaborating because of a virtual visit with your doctor, whether you're collaborating with the community, collaborating with an education organization, to, in this case, as we were just talking about, or collaborating right now and on this Zoom call. You know, people, you have my name, you have my, you know, where I work and what I do, but to be making those connections to collaborate in order for everyone to succeed, to help people, to pull them up, and to really make sure that you are really using the tools that you have and helping others, or having others help you. That this is the time where it's not to take a back seat. It's really to connect and to collaborate, and that's how we'll get through this. With bumps in the road, but that's how we'll get through it.
Yeah. A year from now, hopefully we'll all be saying, we got through this. We didn't think we would, but we did.
Right.
Penny, you want to add to that?
I think that's so true, that idea of connection. I think the one thing that I look at as I look towards the future is that there's been so much creativity and innovation that's happened. I want us to be intentional not to lose it. You know, we've had to pivot. We've had to do things differently. And there have been so many really cool things across the country that have come out of.
Oh dear.
Oh.
Lost her again.
Oh, her sound. Yeah. Oh.
I'm sure she's saying some great things. We just can't hear her.
Oh no, technology.
Technology.
But I say is we're such a short-sighted society sometimes. And so I just want to make sure that we're intentional about continuing all the things that we've learned that are such positives during this last 6 months, and maybe for the next 6 months as well. And I think it's also taught us some great lessons. I think that sometimes people think that, you know, senior living is sort of stuck in a rut and not able to change so quickly. And I think we've shown that we are, that we can be so creative and innovative. And I think it's really brought out that in people who work and live in senior living communities. And it's shown this resilience for both as well. And those are lessons that I don't want lost as we move forward.
Yeah. One of the things, and I didn't want to gloss over, but Penny, you and I have talked about in the past, and the three of us probably talked previously in this, is that, you know, so many of the regulations are looked at as taking away person-centered care, when in fact they are supporting person-centered care, and they really truly are. We just need to work through this most difficult time with what is most important, but we've made great strides with our regulations to support that initiative. Mm-hmm. There's a question here I'd like to address because I think it's a good question. What suggestions, do you have for rural communities that have limited access to internet service and the elderly population being computer illiterate?
Mm-hmm. That's a good question. You know, I would say that I know that there are the ability to have some grants. So looking for the future for the funding side, that there is that, but the connectivity, I know in some rural areas that it's hard. I don't know if that's really where you start to work on more of a kind of a lesson learned. So as kind of like as one person gets some training, wherever they can get that training. Again, I know the connectivity might be hard, but then that's the person that really tries to work with the community as a whole. So I don't mean to train the trainer, but really looking at if you can get one person that could get some of the training or can get online to get something, and then they're able to bring that back and maybe do it more on a paper platform and try it that way. I mean, that you know, that is hard. I mean, I know some of our members out in Wyoming that there's issues with connectivity and really being able to get what they need to be online. Yeah. But maybe if that's a part of an opportunity.
Yeah.
I also,
certainly our schools are dealing with this as well, and maybe this is one area that we will see improvement with.
I hope so.
I hope so too. And I've also heard about some programs of public-private partnerships in some rural communities of working through the local government, because there are some of those grants out there and with different service providers, so that bringing solid internet into the community as a whole, because it's not just an issue for a nursing home, a senior living community there, it's an issue for everyone, including schools. And so really everybody coming together to work with their local government to try to work on the connectivity issue. Also, as far as the instruction, that if you have a community college and if you have a local school system, to really reach out to them for some of that instruction as well. It's a great way to collaborate. And when we talk about even workforce, bringing younger people into the community, I think is always a really good thing to do, and for this particular issue as well.
Absolutely. Yeah, that was a great question. I think I addressed the question. All right. This has been a great discussion. I think we have a lot of good things to look forward to moving forward. And, you know, whether it's 6 months or a year or whenever that is, we're going to look back and say, you know, there was challenges we didn't think we would be able to handle, but we did. And we got better because of it. And that's what's most important. So I thank you both so much for being a part of this. Pioneer Network is coming up in a couple weeks. So 2 weeks. It's our first virtual conference. So we're excited to be a part of that. And Leading Age is going to be coming up in November 10th through 12th and 17th through 19th. So please look at that and see what opportunities they have. Want to just tell you that the September virtual road trip is going to be with our partnering organization. We're going to be partnering with Reading to Connect. And this is a fabulous program. It is breaking the barriers to reading for older adults and allowing them to reflect, remember, learn, and express themselves. And I will say we are so excited to be running with this program. We've been helping develop their online training, and Susan Ostrowski, who is their co-founder, will be presenting this. You will see it in action. You will hear about the research behind this program. And again, we could not be more excited about partnering with Susan and Reading to Connect in getting another program out to the world that we feel is innovative and transformative, really. Also want to add that on September 29th, we're adding another webinar from our partners from James L. West Center for Dementia Care. This one I think will be wonderful for anyone. The heartbreak and cost of isolation, strategies for coping with the pandemic. We can all learn. Holly Glover is a certified licensed professional counselor. We're going to take a deep dive into coping techniques, how to reframe our emotions, and lean into this discomfort of isolation. So we'll be getting that out to all of you on those 2 webinars coming up. And with that, I just want to thank you both again so much, Janine and Penny, for joining. Penny, I know you are super, super busy right now getting ready for the conference. Janine, you are ready to go out and hit the beach on Cape Cod. She just got there, so thank you for taking the time.
Yeah, thank you.
And
thank you for having me.
And thank you everyone for joining us, and we hope to see you in September for our virtual road trip. Thanks so much.
Thanks.
Bye-bye.
Bye.